So in this video, I really wanted to talk about what being a per diem physician looks like. So I get so many new injectors, they're nurses or doctors, and they really want to kind of branch out, do aesthetics, and kind of get their feet wet and possibly open a med spa. So one of the best ways to do this is, before you make the complete leap, talk to your employer, your clinic or your hospital about going from full-time to per diem or hourly. Now, I understand for some people this won't work because it means that you lose your benefits. It means you lose your health insurance, you have to pay for that. You may not be paying into your pension, your retirement plans, so you're gonna have to figure all of that out. But if you're really passionate about starting a business or doing aesthetics and seeing where it takes you, per diem is a really great way to have some flexibility. So I also recommend it for anyone coming out of residency because it gives you a great opportunity to try out different settings, try a side business, and gives you that flexibility. So I'd say the two most important reasons to do per diem, one is for the flexibility and two is for your network. So one, the flexibility, they're not going to be able to tell you, no, you can't work for us because you have your own business. You're going to be able to have the negotiation power of saying, I want to work these days, and then on the other days you can work on whatever projects you want. And then the flexibility also provides you a little bit of downtime as you're building up your company, as you're creating all these new ventures. And then the second part is the network. So as you are ramping up your business, whatever you're doing on the side, don't be afraid to kind of tell your per diem coworkers exactly what you're doing. You may want to just think about if you are starting a medical practice, you don't want to be soliciting clients from where you're working as a per diem doctor because you can get in trouble. It is in your contract that you, for most places, that you're not going to steal clients. Like say you're doing maybe primary care and you're per diem at Kaiser or somewhere else, you don't want to be soliciting clients. But coworkers, other people you come into contact through with your network is going to be super powerful. So even if you're starting a med spa and you're kind of getting going, even doing per diem work like one shift a month is really going to help you just meet more people. And it also helps other people see what kind of physician you are, what kind of nurse you are, can they trust you? That in itself, that reputation of the type of practitioner that you are, that's going to serve you 1,000 times better than any Yelp review, marketing, paid advertisements. What really helps is for people to know what kind of doctor you are and that you really take care of your patients. So I've also had a couple doctor friends who were working full-time somewhere and they were really burned out, and so they switched to per diem and they didn't even know that it was an option. So I really wanted to make this video to let you know that if it doesn't exist, you can always ask your work, hey, what would it be like if I actually switched to hourly? And a lot of times they want to keep you in some way, so they'll say, okay, you can do per diem as opposed to you just leaving entirely. So I encourage you, if you're burnt out or you're thinking about a side business, talk to your clinic or your hospital about per diem work. I hope this helps, and DM or comment below with any questions.